So in the series of the pharmacokinetics, we have started discussing about the absorption, distribution, metabolism and excretion. And in the previous session, we have started with what is absorption and which are the different factors that can affect the absorption. There are three types of the factors, and in these three types, so there are certain drug related factors, there are certain physiological factors, and there are certain pathological factors, and we have started discussing the physiological factors. And in this we have discussed about the ionization status and the pH of the fluid, and it is the unionized part of the drug that is going to be absorbed, and the weakly acidic drugs, they are better absorbed from the stomach, while the weakly basic drugs, they are better absorbed from the small intestine. Fine, but over and above that, the important point is the surface area, and the surface area of the small intestine is very large as compared to the stomach, and that's why whether it is acidic drug or basic drug, all the drugs that are better absorbed from the small intestine. Okay, so this is a more important determinant factor, and the drug is better absorbed from small intestine. Okay, now today we are going to discuss about first the gastric emptying time, then enterohepatic recycling, and the presence of the other agents in the stomach. Okay, first the gastric emptying time. As we have discussed, the major amount of the drug that are absorbed, from the small intestine. Okay, so the point is that when you take the drug orally, the time that is required for the gastric emptying, means the time that requires from which the drug from the stomach reaches the small intestine. Okay, that time is very important. Now if this transit time is less, it is very obvious that there is a rapid absorption of the drug, that is one, and the rate of the absorption is increased. Okay, and that's why there are general dictum, there are exceptions that if the drug is taken on the empty stomachs, it is better absorbed. Now there are other factors also for that. I am not going to discuss this right now, but at the same time, any factors that delays the gastric emptying time, it will decreases the rate of the absorption, that is one, and it will delay the absorption also. Okay, it will delay the absorption also. And which are the agents or the factors that delay the gastric emptying time? Most common is the anticholinergic agents. They delay the gastric emptying time. Is there any pathological condition? Yes, migraine. In the migraine there is a gastric stasis, and because of this gastric stasis, the drug that you are taking for the relief of the migraine headache, it reaches delay to the small intestine, and that's why the onset of the action of the drug is delayed, and that's why antiemetic prokinetic agents are given along with the analgesic agent in case of the migraine. So in short, any agent which delays the gastric emptying, it will decrease and delay the rate of the absorption, and vice versa is also true. Now the second point, which is also very important, that we have already discussed, the major amount of the drug is going to be absorbed from this small intestine. But if any agent which increases the intestinal motility, say for example there is a diarrhea, so the gastrointestinal motility significantly increased, and that's why what will happen? The contact time for the absorption it will significantly reduces. So any factor so any factor which increases the intestinal motility, it reduces the time for the absorption, and that's why the net absorption is going to be reduced. Now there is one another point, that which are the factors that affect the gastric emptying time. Which are the factors? Now it is very obvious that presence of the food in the stomach, it will delay the gastric emptying time. That is fine, but again, which type of the food, the content of the food, whether the carbohydrate content is more, fat content is more, protein content is more, it is the osmolarity, it is the amount of the food, all these factors it will affect the gastric emptying time, but we will not go into the detail of that. Okay, fine. Now next is, along with this we are going to discuss the presence of other agents. Okay, so now as I told you that if the drug is taken with the food, I am giving you the classical example, that iron we are giving for the ferrous sulfate and all that, we are giving for the iron deficiency anemia. Okay, now these iron absorption is better if it is administered along with the vitamin C. Vitamin C enhances the absorption of iron. Okay, now there is a negative example also. If you are taking the milk or the antacids, what is the similarity in this? Both these contains calcium, and this calcium, it will reduces the absorption of tetracycline. Then if you are taking, you all know about the fat soluble vitamins, vitamin A, D, E, K, and if these fat soluble vitamins, they are taken along with the liquid paraffin, their absorption is going to be reduced. Okay. Now there are certain examples. Say for example, the ketoconazole. If you take griseofulvin, it is a antifungal agent, and its absorption is specifically increased when it has been taken with fatty meal. Okay, so dear friends, I want to convey that whether you are going to take the drug along with the food, it is not only going to affect the rate of the absorption because of the gastric emptying time, but there are certain other factors also. As I told you, in case of the iron, in case of the tetracycline, in case of the griseofulvin, so presence of other agents in the stomach also affects the absorption. Okay, so now the next is the enterohepatic recycling. But for that, first you have to understand this concept. What is this enterohepatic recycling? Okay, now here you can see that this is the liver and this is the bile duct, and this bile duct, you all know that it is open in the duodenum. Okay, so now suppose, say for example, you have taken the drug morphine. Okay, now these morphine, it will enter into the stomach, and this morphine from the stomach enters into the liver for the metabolism, and in the liver the glucuronidation will occur, and the morphine is converted into morphine 6 glucuronide. Okay, now this glucuronide part, okay, this is secreted after the glucuronidation. It is secreted, enters into this bile, and it is secreted in the intestine. Now here you can see that now in the intestine, with the help of the intestinal bacteria, what the intestinal bacteria will do, that these intestinal bacteria, they will again split off this glucuronide and again makes the morphine free. And this morphine is again going to be absorbed from the small intestinal wall, enters into the systemic circulation. From this systemic circulation, again this morphine enters into the liver. Again in the liver, the morphine is converted into morphine 6 glucuronide. Again this morphine 6 glucuronide secreted through the bile into the small intestine, and this cycle goes on and on and on. But what will happen because of this cycle? That the bioavailability and the absorption of the morphine is going to be increased. There are various other examples also, like the chloramphenicol, paracetamol, and various other agents also showing the phenomena of enterohepatic recycling. So in short, these enterohepatic recycling, it will increases the bioavailability of the drug. Presence of the other agents, they may increase, they may decrease, depends on the type of the drug and depends on the type of the food that is present. Gastric emptying time, the more hastening of the gastric emptying time, the rate of the absorption is going to be increased. And today we also cover the last part of this physiological factor, that is first pass metabolism. First pass metabolism. As the name, I have prepared a separate video on the first pass metabolism, and the description of the link you can find in the description box. But as the name itself suggests, first pass metabolism, it means the metabolism of the drug during its first passage through the liver. The drug is going to be metabolized in the liver before entering into the systemic circulation, and because of this, the bioavailability of the drug is reduced. More the first pass metabolism of the drug, the bioavailability is reduced, and if the bioavailability is significantly reduced, say for example the lignocaine, you can't give the drug orally, but if the bioavailability is reduced, but still you can give the drug orally because it is safe, that is one, and because there is a not complete metabolism. And the example is, you can remember like this: one beta blocker, that is propranolol, and one beta agonist, that is salbutamol. Okay. So in short, we have covered all the agents related to the physiological part for the factors that affecting the absorption. That starts with the ionization, pH of the gastric fluid, then the surface area for the absorption, then gastric emptying time, then enterohepatic recycling, then presence of other agents in the stomach, and lastly the first pass metabolism. In the next session we will discuss about the factors related to the drugs. Okay, thank you.